Hello, you guys. So, have you ever wondered, I'm improving my posture, it's correct. Why does it still hurt? You try to fix it, you sit up straighter, you pull your shoulders back, but within a few minutes, your body starts to ache? Or are you one of those people who, if you slow down or stop, everything starts hurting, so you have to keep moving? You may be thinking, am I doing it wrong? But here's the truth. Pain in a normalized posture doesn't necessarily mean something's injured. It means your fascia is sending information, because fascia isn't just structural. It's also sensory. It gets all this feedback from millions of little sensory fibers within it. And that means it influences how your body decides what feels safe and what feels like a threat, and when it needs to amp up tension. I'm Dr. Melanie Carlone, physical therapist, somatic practitioner, and someone deeply interested in how the nervous system and connective tissue interact with each other. So welcome to the Fascia Frontier Series. In this series, we're exploring fascia in its many respects, not just as connective tissue, but a dynamic sensing network that literally shapes how your body moves, adapts, and heals. And today I want to talk about what many people experience. Pain in positions that's supposed to be good posture. Like, why is it hurting? Because if fascia can sense tension and pressure throughout the body, the real question then becomes, what exactly is it sensing? For many years, fascia was thought of like a passive saran wrap kind of thing that surrounded your tissues, underneath your skin, held your muscles together. When I did anatomy, in clinic, in lab anatomy, we used to throw away the bits and pieces that were fascia, thinking it was not relevant. But now we realize it's very different. New research has revealed something so fascinating. Fascia has this incredible number of sensory nerve endings, and it's constantly sending signals to the brain about pressure, stretch, load, your movement. And those signals all work together to organize your nervous system to decide how to organize your posture, what muscles to tense, what to release. So in other words, fascia participates in what we might call the body's decision-making processes about safety and stability. So if fascia is constantly sensing and communicating, why would a posture that looks correct still feel uncomfortable? Your nervous system doesn't organize posture based on some textbook of alignment. It doesn't care about that. It organizes posture based on what it's become accustomed to, what it's used to. So if you've spent years leaning forward, driving at a computer, your fascia adapts to that position. It shortens in the front, it lengthens in the back and is weaker. If you've been bracing your abdomen under stress, your system adapts to that. So when you suddenly sit upright in a more correct posture, your nervous system may say to you, uh-oh, this is not safe. Fascia sends a signal to the brain that says, this feels different. Are we literally safe here? And those signals show up as tension or discomfort. Not because your posture's wrong, but because the system hasn't learned it yet. So how do we help fascia and the nervous system learn new postures safely? One of the biggest mistakes people make when trying to correct their posture is holding themselves rigid. So if you sit at a computer and you perch, rigidity in the low back of perching increases tension. So we really benefit from learning to introduce small exploratory movements. That's what somatics is about. Let the nervous system and the sensory system update its map because you're paying attention to the tension. So let's try something together. Be mindful when you do this. Don't hurt yourself, because especially if you're at your computer or texting, most of us tend to be rolled forward in the shoulder. So we get short from here to here. And when you try to lift your arm, you're banging your humerus into your acromion process. That's what causes rotator cuff issues. So be gentle. I want you to sit up comfortably and try to lift one arm overhead. And for many people, you'll start to feel the tension somewhere mid-range, going towards end range. But just lift your arm and notice how it feels to lift. Does it feel smooth? Does it feel restricted? Does your rib cage move? What's happening in your armpit? Okay, just notice how much stress is there in the neck. Okay, now let your arm come down. Let it all percolate in because we're going to do that movement again. And we're going to explore the direction of ease. We're going to explore the direction of the musculature that's been holding your arm forward. That's the easy one. So I want you to lean to the side of your arm and rotate into your arm. And imagine, so you're leaning in and you're rotating, imagining there's a heavy weight here and you're pushing it. So feel a hand on your opposite shoulder. Push. Keep breathing in your low back ribs. Let your eyes go to the side, signaling the nervous system of safety. And then breathe in the low back. Keep breathing. Come out. And we're going to do that 5 times. So again, you're going to side bend and rotate and imagine pushing a heavy weight with this shoulder. You'll feel it in your right and the side that you're rotating towards. Feel it tense. Breathing in the low back. Eyes to the side. Come back up. And again, rotating towards the side that you lifted the arm and down like you're pushing a heavy weight with your opposite shoulder. Breathe, eyes to the side. Moving slowly gives the nervous system time to adapt and change the neural pathways. One more time, rotate, heavy weight in the opposite shoulder. Feel it, pushing down, pulling, beautiful. Now come back up. So what do? We just activated the protector. Now, raise your arm again. And just notice, sometimes just that small shift allows the arm to move more freely. Can you feel it? You feel how it's easier almost all the time or less pain. Beautiful. So if your range improved, it's not because you forced anything. It's because the sensory system reorganized as you recognize the protector aspect of it and you allowed it to soften. For those of you out there who know internal family systems, this sounds familiar. This is somatics in the body, and that's more cognitive somatics. So, interesting question. If fascia helped your brain decide what movement feels safe, how can you update those decisions? How can you help it feel safe overall as a practice? And these days, we need to keep practicing because a lot of us are feeling increasingly unsafe, and we can do something about that. How do we give fascia better information? Well, it responds to information. It responds to your breath, your pressure, movement, where you orient your attention. It's constantly changing your fascia. And when you vary those signals, when you do them in a way that softens the nervous system and you vary them and it becomes more soft, responsive, the nervous system becomes more adaptable to change. So that's why these small movements of ease combined with safety cues can create big changes. So what are safety cues for the nervous system? You got to talk its language. Orient your eyes and awareness to the environment. I've been talking about this in my other videos. Letting your head stay still and just move your eyes. Catch an object, simple object. Notice what you can about it and then turn your head towards it. Keep breathing in the low back rib breathing, really calming for the nervous system. And then move your eyes again. Let your eyes land on it. Notice the color, the shape, the texture, and follow with your head. So this is signaling the nervous system that vigilance or hyperattention is not needed because you're paying attention to the periphery. Very powerful. Also, low back rib breathing is really not well known. We all do diaphragm breathing, but breathing into the low back ribs invites the body to pay attention behind you, which again is a way of reducing vigilance out front. And the last thing we did today is moving slowly with intention towards the protector or towards the sides of ease instead of trying to force the restriction. All these gentle inputs, somatic inputs, tell the nervous system something really important. We are safe enough to explore. And exploration and curiosity is how your system updates its internal map. So the next time posture correction feels uncomfortable with you, what if instead of holding yourself still or constantly moving, you allowed your body to explore meaningful movement towards the protector? the protector. Perfect posture isn't the goal. Flow is. Resilience is. A body that moves easily between positions is far more resilient than one that's holding a rigid alignment. And that's true for so many things in our lives. Your fascia thrives on movement, on your breath, on variability, on being told things are safe. So instead of forcing your body into a shape, think about helping it restore flow. And when flow returns, posture often improves dramatically and naturally, not because you forced it, but because your system reorganized itself. So, if you've ever felt pain in what seemed like good posture, remember your body isn't failing. It's not falling into disrepair and not listening. It's actually communicating. And fascia is constantly sensing and adapting. And when we listen to that system instead of trying to override it, we begin to restore the ease and adaptability your body was designed for. You are built towards health. So if you tried that small movement test with your arm, let me know what you noticed in the comments, and do it to the other arm. Your body gives incredible feedback when you slow down enough to listen. And if this exploration of fascia and the nervous system awareness resonates, make sure to like this video and subscribe. Because in the next episode of Fascia Frontier, we're going to explore something many people carry in their posture. We're going to go deeper into protector patterns and where they are, and how stress and past experiences can shape the way the body holds itself, sometimes for years. So until next time, remember, we're not forcing flexibility. We're restoring compassion and permission. So smile gently from the corners of your mouth. Let it go into your eyes, into your body, and have a great day, you guys. Blessings.